different forms of cancer.
Oh, wow.
Well, actually, yes, Roundup. Do you know Tony Pugh? FabArc Steel.
I do know FabArc.
He's the president. It's his family that owns it. Yeah.
Okay, because I saw a guy that went to high school with me works there, and his mother-in-law was watching tonight because she lives down the hill from me.
Oh,
she
cool.
didn't know I have this show.
Oh, wow.
So I wonder if he
Yeah, I may have.
mics are hot now.
Tony.
Well, we talked to them the other.
Hi, and welcome back to another episode of Truth, Health, and Wellness with Dr. Matt and Deborah St. John. We're excited you've joined us here today, and we've got a special episode for you. So if you do have questions, as always, feel free to go ahead and send those in via Facebook. But today, we've been talking some about animals and cats and stuff, and we got onto some crazy subjects. So
Behind the scenes, we've had a lot of
Yeah.
really cool conversations, and the conversation got over on parasites.
Yeah.
And in my study, I've shunned away from a lot of the study on parasites because there's some interesting people who seem to be obsessed with them. It's very strange, which is a weird thing to me. But as we've moved forward, parasites are such an incredibly important issue and problem in our human body that we're just now realizing, I think, the full extent of the impact that these things are having on us. But there are a particular few parasites that are especially concerning, and one in particular that I'm not obsessed with it, but let's just say that this parasite is the oldest parasite in the world that's known. It's been found in Egyptian mummies. It's possibly led to the downfall of every large civilization that's ever existed on the earth. That's a big one. And 60% of humanity currently has the cyst of this parasite alive in their brains right now. And I'm not joking. 60% of the people that are watching this right now have a parasitic brain cyst called T. gondii or Toxoplasma gondii in your brain right now. And it can actually and is controlling some of your human behavior in not so great ways. So we're going to talk about this particular parasite. We do a lot of education, and we've done seminars and conferences, and we do a PowerPoint presentation on this. And normally by the time it's over, people have their jaws on the ground, and they're running to us trying to figure out a little bit more information. But it's something that is a really interesting study, and we're going to go into that today, I guess.
Well, yeah. So let's go ahead and tell me, how was this discovered? I guess where did you mentioned something about mummies? So should we go back and start from the beginning, or where?
Well, with Toxoplasma gondii, it once again is the oldest known parasite in the human body. There's something called toxoplasmosis, and this is where most people are going to. So far, I've just lost the majority of people. They're like, this guy's crazy. You know when you have a female who's pregnant, and the physicians will tell her, don't have anything to do with a litter box. Don't clean the litter box. Don't be around the litter box. Don't be near the litter box. Well, there's a reason for that, and the reason is Toxoplasma gondii. Now, Toxoplasma gondii can be given directly from the mother to the infant and will cause birth defects. And can actually terminate the pregnancy. So it's very important for pregnant, but it's not just about pregnant women. And this is, we're not anti-cat. I actually, last night we were petting two of the most beautiful cats I've ever seen in my life. I did call one of them T. gondii, but that's another story. We'll be in Iquitos, and there'll be like a stray cat on the, laying there, and I'll like, be like, T. gondii. And so I used to
T. gondii 2.
Yeah, I have like pictures of me in Ephesus in Turkey, where every time you had any type of and there of course these are the ruins in Ephesus, like where Paul stood.
Right.
And so I stood on the stage where Paul stood, got yelled at. I sat on this statue that was actually the medicine. It was in front of a hospital at the time, and so it was this statue, and I sat down on it and took a picture, did a picture on it, and in the back you can see the guide screaming at me, and so that's back when I had T. Gandhi. But what's interesting though, when we went to Ephesus, is every boulder, every rock, every statue, everything there had like 2 to 3 cats at it.
Wow.
I had lunch with someone, and we had like 30 cats under our table. Cats everywhere. And so it's really interesting when you look at the cats, when you look at, and once again, we're not anti-cat. I love cats. I think they're beautiful. And I used to be a cat person until we got our dog Cookie. But yeah, it's a major thing, and actually it's interesting because this particular parasite is contributing to sociopathic behaviors, suicide, people who are have no conscience, people who are having all kinds of issues with multiple cancers and so many other things. But the behavior part is really interesting to me, and we're going to get into that. I think we have some slides too that we're going to put up.
Sounds like most of society today, pretty much. Which one should we start with first, so we'll know what slide to pull up?
This one.
Okay.
Yeah.
So there's basically a 50% chance.
Well, there's what is T. Gandhi? Toxoplasma gondii is a protozoan parasite that infects most species of warm-blooded animals, including humans, and causes the disease toxoplasmosis. Go to our next one. Now, it says here 30 to 50% of the world is infected. I believe that number is 60%.
It's increased significantly since this study
slide
was done.
Wow.
Yeah, when was this study done?
2014.
Oh yeah, it's been 10 years.
Yeah.
So a decade later, we're at 60% now. So now you have more sociopaths, more people who are, involved with this particular. And once again, this is the cyst. This is not even the parasite in its full infection stage. This is literally what we're talking about in this, and we might talk a little bit about toxoplasmosis, which is often confused with multiple sclerosis. They say it can cause multiple forms of dementia and Parkinson's symptoms and a ton of other symptoms that are mistaken for some other disease other than the fact that it's a parasite.
Wow.
And okay, we're going to get into also how on earth do you even know that you have this? Well, that's the really difficult part. But yeah, it's more like 60% now. We'll go to the next slide.
Let's see.
Where does T. Gandhi come from? Well, it comes from cats. The only known host are members of the feline cats, or cats and their relatives, and the cysts are shed in the cat's feces. But that's not the way that most humans get T. Gandhi. Most humans get it from undercooked meat, literally walking with no shoes on the ground when you've had animals defecating and so forth, and just a host of other issues. But literally just going and having some sushi can give you T. Gandhi.
Wow.
So it's pretty easy to get.
And when you said that about the feet, you made me think, when I was in Africa, everybody on my team ended up with worms except for me, because they went without shoes on the beach and the worms came up through the sand.
Wow.
And all their feet and started but that's what, when you said that.
Yeah, it's important to take precautions, and they talk about grounding, and that is wonderful to do grounding, but I would rather wear grounding shoes and still have a little something between my feet and what I'm walking on, knowing what people and animals do on the ground.
Absolutely.
Well,
Why so much cat work? Now this is interesting. So the Egyptians worship cats, the Greeks worship cats, the Norse worship cats, the Chinese worship cats long ago. And the Polish worship cats. And from the mid-950 BC, domestic cats were increasingly worshipped and considered sacred. Now, what would make a human being worship a cat? Maybe parasitic cysts in their brains.
interesting.
Mm-hmm.
And so when you get into this study of this particular parasite, it's really interesting because all of these huge groups of people, Egyptians, the Norse, the Greeks, the Polish, all of these, they're all gone. They don't exist anymore.
Yeah,
Their civilizations are gone. Now, why is that?
because of the parasites in the brain.
You tell me. But it's very interesting that you have, they've recorded, so that mummies actually having these parasites. See, mummies with parasites, and so that most ancient mummies that we find still have these cysts found in them. Now, isn't that interesting?
It's mind blowing to that extent.
And I want to get really to some of the what this particular parasite's really doing to people, because it's really interesting. We'll go to the next slide. How does it get into the brain? It's really interesting too. It's a very sneaky parasite. T. gondii hijacks the immune system and actually runs through the brain, passes the blood-brain barrier because it's able to mimic the immune system. And within the cells, it has its own little batch of food that it keeps in the cysts.
For all those years.
All those years. So it doesn't need, so your body can't tell that it's a parasite, because parasites normally are trying to eat your food.
Feeding off of,
right.
yeah.
But
and it blocks the beacon, you know, that tells your immune system
to
that
attack
it's there.
So it just slides right through.
Totally blocks it.
And it goes into your brain, and then the cyst will stay in your brain until your immune system is compromised, your stress level is through the roof, or something horrific happens, and then it can set off toxoplasmosis. And you'll literally at that point see lesions in the brain.
Your cyst will open and the parasites will.
And then you have multiple sclerosis, maybe you might have Parkinson's. They're going to be running through the doctor trying to figure out what it is. And most of the physicians will not test. Because first off, how are you going to test for a parasitic cyst in your brain?
Yeah.
What do you have to do? A biopsy, right?
Biopsy. Can't biopsy a brain.
Can't biopsy a brain, not a live one. So this is really interesting. That's the roadblock. That's why doctors don't talk more about it. It's like, oh well, this exists. This is a problem. It's literally changing human behavior, causing people to be sociopathic and suicidal and murderers and everything else. But we don't have anything for it. And I tell you what, modern medicine hates parasites.
They really do.
Why? Because there are a lot of people that believe that parasites are one of the primary causes of cancer. Now, that's for another day. But let's go to the next slide. Here's a little diagram. I like this diagram, but it's so far away from me right now I can't really read it enough to talk about it. But it basically tells you how you can get T. gondii, and it's multiple ways. Foods, countertops, I think let's say raw or unpasteurized milk. Actually, I'm not so big on criticizing that. Unwashed fruits and vegetables, raw seafood, undercooked meat. This isn't a great testimony for sushi, is it?
Contaminated water.
Contaminated water, and just surface water. So it's pretty incredible, really, what we're seeing with T. gondii and how easy it is really to get it. Now this gets into how does the parasite affect us? Okay, male reproduction impairment. It's been shown that T. gondii, even at the cyst stage, can cause males to have issues with fertility and reproduction. Go to the next slide. T. gondii alters human behavior via the dopamine and testosterone pathways. So once again, I think this was an article in Schizophrenia Times. That's pretty interesting to me. And it talks about we're citing clinical studies for a reason. We're wanting to show that normally if you hear about parasites and you think alternative medicine and you think, well, it's snake oil salesmen in a covered wagon that are spouting off about these parasites. No, that's not the case. We have study after study after study. Why? Because it's the oldest parasite known. They just can't figure out how to get rid of it. We do, though. This is really cool.
That's what I was going to say next. There is an answer to this coming.
Look at this. Extroverts with no conscientiousness. It's been shown clinically that it causes people to become more extroverted, but also have little to no conscientiousness, no empathy.
That's crazy, and it sounds like a lot of people in society today.
I know. And we're going to just wait. Next slide. Neuroinflammation. T. gondii reduces predator aversion in rats through epigenetic modulation in the host medial amygdala. The issue here is that the rats who normally would not go to a cat, they have an innate nature not to go to cats. They know to stay away from cat urine.
They're going to be dinner.
In the studies, it actually shows that these rats are attracted to cat urine. It changes it. The parasites are telling the rats, hey, you need to go to the cat urine. Go to the cat urine. So the rats will go to the cat urine. It made foxes more likely to go up to their primary predator, which was a cat in this particular country. And it basically just does away with fear, but it does the same thing in humans. You know that if you have T. gondii, you're more likely clinically to be an entrepreneur. to be self-employed.
Do they purposely inject some people with this? I wonder.
I don't know. I mean, well, and there's another one. Let's put up the next slide and let's see what we have here. This is where it can contribute to cancers of the eye, brain, blood, and breast. And once again, this is more of a physiological. This is interesting. It causes a heightened sexual attraction to fear, danger, pain, and submissiveness. Now, if you're wondering, why your ex-husband was such a weirdo freak, this might tell you. There's some serious issues when it comes to people who are into that sort of thing, and it's very interesting when you start studying as to why they're doing it. Next slide. Mental health and schizophrenia. Remember, we saw an article from the Schizophrenia Times a second ago. The risk factors for schizophrenia. This is often misdiagnosed, so it's super, super important to know, and most people simply don't. This is talking about negative effects of latent toxoplasmosis on mental health, which we have multiple studies on that. This is an interesting article that talks about homicide in T. gondii, saying basically that you're more likely to kill someone if you have this particular brain parasite cyst. And once again, remember, 60% of our world has this cyst.
That's it's mind-blowing. It is like, what do you do? And it literally sounds like this thing is rampant in the world today with everything that's going on.
T. gondii is mind-blowing. That's good. Epilepsy, constantly misdiagnosed as being epileptic or epilepsy. It contributes to epilepsy, but it actually causes the epileptic symptoms, seizures, and so forth. Suicide and depression. Most people who have T. gondii will experience certain levels of depression, but normally they're so sociopathic they don't have time to be depressed because they're too busy ruining other people's lives. But it also makes them more likely to commit suicide. But normally that's when things aren't going well, obviously. The depression and leads to suicide in a lot of cases.
I think that's in females a lot.
Yeah, more in females than men. Now this is interesting. On the way here we were discussing how there were 2 separate traffic accidents on 2 separate sides of town here in Oxford, Alabama. And this talks about where they actually did a study in Turkey, which is interesting too because I've been to Ephesus before and actually hung out with cats in Ephesus. But this talks about that infected rats become more exploratory, more open to taking risk, and become altogether more impulsive. The thing too is that people do that as well. And in this study in traffic, they were basically saying that one of the reasons traffic in Turkey was getting acceleratingly bad was because of T. gondii.
Wow.
Because you get a sociopath behind the wheel who has no conscientiousness or no empathy, then guess what? They're going to pull out in front of you. They're going to hit you and keep going. They're going to do all kinds of things. And so literally, this is a problem that's affecting society to the point where it's affecting law enforcement and transportation. Fatal attraction. This is where we talked about. That's an interesting looking highlight. Rats were put in a room with cat urine in one corner and rabbit urine in another. Normal rats have a strong hardwired aversion to cat urine, as you would imagine. But the T. gondii infected rats were actually attracted to it. And this is an example of the manipulation hypothesis in evolutionary biology, where a parasite may alter the behavior of its host, but for its own benefit, usually by enhancing its transmission rate. So here's the deal. We've done what we normally do, and we kind of traumatize everyone and talk about things that makes everyone uncomfortable and a little concerned. But we wouldn't talk about all this if there wasn't a way to deal with it.
I'm glad, because there's a lot of people out there that need help.
Yes.
You have that right. And it says how to diagnose. Simple. Just biopsy your brain. Just go to your local college and university and to their science department, biology department, and say, I would like to donate my brain to science. And then they can open it up and tell you whether or not you have, So that's not good.
That's definitely not
a
going to
great
work.
way. How to diagnose? Well, it's very difficult. One thing would be to see if you have any of the symptoms. There's a study that's very interesting that I don't think we have. I think I do have it. I did send it, but it talks about it's really crazy. They did a study of normal people without T. gondii, observing photographs of people with T. gondii. So let's say we get 20 people in a room and we sit them down in front of a screen, and then we show them pictures of people. And we ask them, are they attractive or are they unattractive? And if so, why or why not? Now, I wouldn't want to have my face put up there and have people sit and have to hear what they said, but these people did. And here's the crazy thing. The infected people, the people who were infected with T. gondii, who they saw the photograph of, 98% of the time?
It was the majority.
It was the 98% of the time, the people who didn't have T. gondii, who were sitting there observing, would look at the photographs of the people with T. gondii, and they would say that they were more attractive. Literally, T. gondii clinically makes people more attractive to people who don't have T. gondii. And there's clinical studies to support that. I wish we had that slide, but we'll show that sometime. But it's really amazing.
I don't think I have it.
It's there somewhere. It's like buried.
No.
But yeah, it's absolutely mind blowing. I mean that's incredible. It makes no sense.
Yeah.
And it has. They even talk about the jawline circumference and the way people's faces. I mean, and so it's absolute insanity, really. It was somewhere in there.
Oops.
That's fine. Okay, so how do we get rid of this? How can you get rid of the cysts that only biopsies show? Well, clinically we found that black seed oil. Now black seed oil is actually black cumin seed oil, and it's used for a whole lot. My goodness, the uses of black seed oil. I mean,
Tons.
People come in and it's for my arthritis, it's for my inflammation, it's for my skin, it's for my skin pigment, it's for my it's an antiviral. It's incredible for the immune system, incredible for the cardiovascular system, and also, it's also been clinically shown to get rid of T. gondii cysts. So that's pretty amazing. We actually have a formula that we've developed. It's almost finished. We're almost finished with the testing, and that it's going to basically be what we're talking about, but it's going to be in a base of black seed oil.
Now, will they start to notice or feel something different within so many, let's say, said days or weeks, or what?
And on the 4th week, they get ugly. I'm just kidding. That's what happened to me. No, it's interesting because they will start noticing a difference normally.
Okay.
And normally in behavior. Now this is kojic acid, very similar like fulvic acid. It's one of these new earth elements that are getting very popular. And so kojic acid is also recommended in the case of toxoplasmosis and also with the cysts. Go to the next one. Rosemary leaf terpenes. Now this is pretty exciting because we hear about essential oils all the time, and then people make fun of like the essential oil moms who are like selling Young Living oils at home, and they're like, trying to sign up all their neighbors and stuff.
Right.
But the reality is essential oils are amazing. And I believe that the next frontier in natural medicine is going to be essential oils and medicinal mushrooms. I think those are going to be the terpenes from essential oils, and medicinal mushrooms are going to be the next frontier in natural medicine. And this talks about rosemary leaf terpenes being extremely beneficial to use not only during toxoplasmosis, but to also help get rid of the cyst. And the cool thing is that rosemary leaf terpenes are excellent in a carrier of the black seed oil, and also kojic acid mixes in really well. So we're working on a formula here, as you can see.
The rosemary also is prophylactic.
Yes, it is. It helps to keep it from happening.
So if you have a cat, take some rosemary, and you might not get the cyst. Yeah.
Or the T. gondii formula. What are we going to name it? Oh, what was it? Neuroinflammation. Oh, that's right. We're coming out with a formula called neuroinflammation.
Okay.
And there's an interesting thing. Most people who have T. gondii don't want to get rid of it because they have a brain parasite that's telling them what to do.
Right.
So literally, there are people watching this right now who you feel an aversion for some reason for everything you're hearing. That's because you have parasites in your brain, and you need to get rid of them. And so the rosemary leaf terpenes can help. The black seed oil can help. But it's very interesting how people who have T. gondii tend to not want to hear about it. And once again, it goes right along with the behavior aspects of what we're talking about. So it's really cool. And what else do we have here? Thyme, good old thyme. Thyme's an antiviral. Thyme is incredible. Matter of fact, Thymol was actually, or thyme was used by Walmart during COVID. They sprayed everything, the buggies, the lobbies, and everything with it to prevent COVID. So it's really amazing stuff. But thyme is very effective also against toxoplasmosis and the cyst. So basically, a black seed oil, if you have a carrier oil black seed oil and you add the rosemary terpenes, the thyme, and the kojic acid, then you have yourself a formula. And then if you throw in a little bit of, next slide, oregano oil or carvacrol, then you have a true winner. Carvacrol is amazing. I know this station loves carvacrol. It's like everybody here is like taking the oregano oil and the P73, and it's awesome. But carvacrol is extremely effective against not only parasitic cyst, but any type of virus. We had talked about it before, I think, last week about several things. But it's really neat to see how, once again, and every one of those were terpenes or were essential oils.
Mm-hmm.
So it's really neat to see that we can have a formula that we can get rid of the stuff with.
Well, no, if they take this formula, it's going to eradicate the cyst in their brain, or will it just close off what it's kind of shooting out? I don't know how to.
Well, once again, we're talking about prevention.
Okay.
We're talking about getting rid of the cyst, and we're also talking, which of course, get rid of the cyst, and you're eliminating the possibility of toxoplasmosis, but also to help reduce the inflammation of the brain. So we're actually going to name the product Neuroinflammation.
NeuroCleanse.
NeuroCleanse. There we go. Thank you. NeuroCleanse. And because we want people to understand that it is a cleanse for the brain, it's going to work in a lot of ways, because rosemary terpenes work to do a tremendous amount of things in the human brain, helping us, but it's also going to help to get rid of obviously the T. gondii. But when you reduce neuroinflammation, you have enhanced cognitive function. So what did the sociopathic people who have no conscientiousness, what would be something that would probably appeal to them? Being even smarter.
Yes.
Okay, so that's the reason we call this NeuroCleanse, because we want people who want to be smarter and to clear their heads and clear their minds and be able to use something, and it'll work very well for that. Even if you don't have T. gondii, it'll work very well for that. So the good thing is that the folks that have T. gondii will also help get rid of their cysts.
I'm like, can you have dispensers at traffic lights throughout town as well for all the drivers?
Exactly.
Oh, it's amazing. And what's so wild is we have literally witnessed firsthand so many people that will have a complete aversion. I could be sitting with someone and I could tell them that there were space monkeys, that were, tormenting them at night, and we need to get rid of the space monkeys. They'd be looking at me going, okay, let's do it. But if I were to say something about the T. gondii that they actually do have, they'll back up and they'll be like, well, I need to talk to my doctor. I need to talk to my physician about that. I'll be sure your physician knows about T. gondii while you're at it. So it's pretty wild that we've actually physically seen an aversion in people who have it to doing any type of therapy.
Wow.
So
it's crazy.
Even if you don't have T. gondii, do a NeuroCleanse.
Exactly.
But it's very interesting, and this is just one parasite. There's more and more conversation happening, and a lot of people are talking about how when you have parasites that are in your body that can do so much manipulation. You know what I'm saying? I even had, I talk a good bit to different people that are in my field, obviously, and there's an individual that I'm talking to right now who actually believes that parasites have demonic activity, or of themselves are demonic, or that they, are some, and that's really far out there, but it's really an interesting theory when you start looking at what these things are doing to people and in the human body. So it's an exciting field. It's very interesting. It certainly makes you want to be careful while you're petting your cat.
And I was going to say what you just said actually a moment ago, that it reminds me of a lot of times in a Christian world where they're like, oh, I don't have that, I don't have that problem. I don't have the problem. I'm good. And so it's very interesting.
We see that all the time. They'll just turn the other way. You start talking about it's like if you're talking about in church or whatever. You start talking about demons.
Yeah.
Well, the first way to find out if someone has a demon or not is to see how they react when you have a conversation around them about demons.
Right.
If you want to, and so it's this interesting thing that when you start talking to people about Toxoplasma gondii, the people that you are pretty sure that have it, they're not wanting to hear about it.
Completely closed off to it.
Mm-hmm.
Oftentimes, there are many other parasites that affect the human body.
Oh yeah.
Tapeworms, pinworms, all kind of different. You have there are parasites that you get in your lungs, parasites that can get into every organ, every tissue,
Kidney.
everywhere in your body. And there are a lot of people that do have a lot of this. We go down to Iquitos. We were blown away in Peru, in the Amazon, about how many people had parasites.
Yeah.
I have some stories I can't even tell this late about that, but anyway.
Well, we want to thank you all for joining us today. We have run out of time again, but if you want to talk to them more about this, definitely stop by their store on Snow Street in Oxford, or send them a message on Facebook, and we'll get you some answers. We'll do our best, and they would love to see you. So we want to thank you for joining us. We'll see you back here next week.